Hey everyone, so it's safe to say today's video is the one that most people have been waiting for. I'm going to tell you how you can self-massage yourself with a couple of techniques that us physiotherapists use. So it's important to note that if you get any pain during the massages, you want to make sure you either put less pressure or you just completely stop and have a chat with me just to make sure that this self-massage technique is okay for you, because it's not going to be okay for everyone. It's about just listening to your body, and basically if it hurts then you need to stop. So let's get on with the first technique. Alright, so on the back of your neck, you have your traps and your neck muscles that go up on either side like this. Your spine is in the middle. If you have a feel with your fingers, you will find the knobbly bits, which are your spine, so it's quite hard, you'll be able to feel it. So you want to make sure you don't massage in those areas. So you want to massage on either side of the spine. So take your fingers, use the pads of your fingers, and then you want to find your spine and then pull away on either side of those muscles. So place a bit of pressure and just pull away. So it's almost like you're stretching the muscles away from the spine. You can actually use more fingers to do this and keep your thumbs at the front of your neck. So keep your thumbs at the front of your neck here, just to give you a bit of stability. And then you can use all of your fingers to just pull apart like this. Again, it's really important to keep your pressure really light on the neck. These massages can be quite strong without you realizing, and it may actually cause you more pain than you'd like. So just be really gentle. There's no need to put too much pressure. So keeping that pressure the whole way through as you pull across that muscle. So this is going to release any tension that you have on the back of the neck. And then you can move towards underneath your crown, the crown of your head. So you get underneath your skull, you'll be able to feel it. So feel with your thumbs, put your hands around your head like this. So feel with your thumbs, you'll find the base of your skull, and you want to massage into those areas as well with the thumb. So there's a lot of tension that gets held here, and some of you might find this is really relaxing and really beneficial, but others might find that it's actually really tender. So if you do, you just need to do it very gently. So you just want to place some pressure in those areas and then circle the thumb. So place pressure and circle the thumb whilst keeping the pressure. If you're finding it difficult to circle, that's fine, you can just use pressure. So place the thumb on a point, place a bit of pressure, and then let go and move on to another point. So placing pressure down and letting go. So just work your way all the way up to the crown in the middle of your head. You can do this actually all the way up your head. So if you follow the midsection of the side of your neck, follow all the way up, and you'll find that this feels quite nice and relieving, especially for when you have a headache. And what you can do is actually, because you've got your hands on your head anyway, you can actually just use all of your fingers and your thumb to just work your way around the head, place a bit of pressure, and just release like that. So usually most people get pain on the upper traps and the levator scap, which goes from your neck all the way down into your upper trap. So to get rid of all those knots that you feel in there, what you want to do is actually just feel along the muscle and just see if there's an area that you can find that feels tight, or if you put a bit of pressure on it, does it feel like it relieves it for you? And if it does, then you want to hold that area. So to hold, you can either use the pads of your fingers. Using 2 fingers is a lot easier because you've just got a little bit more pressure, or you can use your thumb if you're comfortable with that. So either using the thumb of whichever hand you want to use, or you use the 2 fingers It's easier to use your opposite hand on the opposite shoulder. So find the spot, hold. So place a little bit of pressure. You don't want too much pressure where it's just too painful. You want something that's like about 40 to 50% of your maximum pressure. So you just want to hold. It's going to hurt a little bit for a couple of seconds. We're going to hold for about 30 seconds. So what you're going to find is with some knots, when you press onto them, you'll find that they send pain to other areas of your body. So if I press on this, sometimes patients get pain all the way down into their shoulder blades, sometimes down the arm, sometimes up the neck muscles as well, and that's completely normal. This is what trigger points can do. Knots in certain areas can cause tightness and pain in other areas, so it's a good sign if you're getting that. But again, as I said, you want to make sure that it's not too painful for you, or it's not causing you pins and needles or numbness. That's really important. So now that you've held it for a little while, you might find that it's starting to get a little bit numb. If it gets numb, then it's good. Talking about the area, if the area under your fingertips starts to get numb and you can't feel the pain anymore, it's a good sign, because it means we've shut off all the blood supply. And by shutting off the blood supply, you're going to make sure that once you release your fingers, all of that blood is going to rush into the muscle fibers and just going to give you some brand new fresh blood to help release that knot. So now we're going to release nice and slowly, and then you want to press again just to make sure, has it released anything? Does it feel a little bit softer? You should find it feels a little bit softer. If it doesn't, you want to do it again. So you want to repeat it 2 or 3 times and then feel around the area to see if you can find some more knots in that area. The other thing that you can do is, if you find the knot again, you want to place pressure on there. Whilst you're placing pressure on there, you want to stretch that muscle. So we're talking about the trap muscle here. So this is your trap muscle, and that's where I found the knot on that particular muscle. So what you want to do is actually stretch that muscle. Just to stretch the trap muscle, you want to bring your opposite ear to your opposite shoulder and then bring your head back. So you keep the pressure on as you're bringing your ear to your shoulder and bringing it back. Keep that pressure on that knot whilst you move your head. If your hand is getting tired, you can support it with the opposite hand, or if you're finding it difficult to move your head back and forth, you can actually hold that stretch and then release. And again, just have a feel around that area and see if it feels a little bit softer. You can do the same thing on the neck. So on the neck muscles, you want to make sure that you're on an area that is the neck muscles are really important to make sure that you're not on an area that is really painful, because there are a lot of structures around the neck area. So you've got your arteries, your veins, your nerves, everything runs through there. So it's really important that you don't get any pins and needles or numbness going down your arms. Any severe pain, it should be something that you can manage quite easily. It might be uncomfortable, but not too uncomfortable. So find the neck muscle. So usually most people get pain around the back of the neck. So always palpate using 2 fingers. So bring your fingers up the neck muscle and see if you can find somewhere that feels a little bit, like there's a bit of tension there, maybe a little bit of pain, but something that's not too painful, not too tender. And if you find a spot, you want to run across the muscle fiber and see if you can hold the knot. And you do exactly the same thing as you did with the first technique. So you just hold for 30 seconds and release. There's no need to do any stretching on this one. So just holding for a few more seconds and releasing. And then again, just want to feel along that muscle, see if you can find something else and do the same thing again.